Orthopedic ski trauma. You might be surprised that people snow ski in Australia. In fact, Australia has a large area, snow-covered area, probably bigger than Europe. Of course, the snow is thinner here than the US or Europe, but at least you can ski in the summer in bikinis or shorts, which is the ultimate experience. There are few avalanches, actually. This is data I collected on 10,000 injuries I personally treated over the period 83 to 86 in New South Wales, Australia. History of the sport. Resuscitation of the slopes not very successful. We can go over the different types of injuries. The knee is the most common. Perisher Valley, development of skis from literally where you strap the foot in to multi-mode release mechanisms. Development of boots, soft leather boots, to now firm forward-leaning boots that hold it in. Dr. Shedden, one of the doctors here who developed and first collected statistics. When I'm looking at 1,850 injuries in the 93 season, all the injuries received by the same doctor showed upper extremity and lower extremity injuries equally represented. Injuries to the head and face accounted for 17%. The injury rate is about 4 per 1,000 skiers. Quite a high incidence of facial lacerations and skiers' thumb or injuries to the thumb. We recommended then that people wear helmets. So the data was collected, risk factors looked at, location of the injuries, and the overview. The trends in the rate and type of skiing injuries in Australia, they're looked at from 62 to 88. There's a total of 22,000 injuries. They're all treated at the same clinic. The overall injury rate was around about 4 per 1,000 skier days, and the specific injury rate was six subgroups of injuries was calculated. The incidence of tibial fractures, ankle injuries, and lacerations was declining over this period, but upper body injuries tend to go up. There was a statistically significant increase in knee injuries. The trends reported were similar to overseas injuries at that time. It doesn't include snowboarding injuries. So Perisher Valley on a busy day, injury rate tending to go down, the lower body going down, but a bit of a general increase in trend. Lower limb injuries going down, upper body tending to go up. Cross-country injury rate was slightly lower, perhaps a little bit more severe. In isolated areas, hard to retrieve them. So we looked at cross-country or Nordic injuries, 88. The injuries were compared with alpine. There's much lower incidence of injury. However, when the injuries did occur, they tend to be more serious. Norwegian gold miners started skiing in Australia 1860, 1861, post-ban polling. Sometimes you get helicopter crashes on the ski field, so they're not very good for retrieving. Slope preparation is very important. Shoulder injuries are very common. Anterior shoulder dislocations, you have to know how to deal with them and reduce them at the time. You can get brachial plexus fractures associated with. Also, acromioclavicular injuries are quite common. With wrist dislocations, wrist injuries, beware of lunate dislocation. Fracture of the femur, here we are using a mask suit. Dislocation of the knee, get several of those, but still a rare injury. Hip dislocations, rare, posterior, and you can also get anterior ankle fractures from poorly fitting boots. Fracture of the fibula at the boot top level. Here's an ankle held firmly in new boots. Major injuries can occur, and here is blood at the tip of the penis from a fractured femur, ruptured urethra. Knee injuries for twisting is the usual mechanism. Fractured femur here. Open tibial fractures, you do see some, you need to have a good protocol to deal with them. Fractured tibia still in the ski boot, still held in position like a splinter or a plaster. Tibial fracture type 2, you tend to do spiral types or boot types, transverse types. Subtalar dislocation and skier's thumb. Ulnar collateral ligament of the thumb may be associated with bony injury. You can use splints or glove modification to deal with those. Arm fractures, not that common, humeral shaft. Easy to miss scaphoid fractures, have to be a lookout. Lacerations are common from the razor sharp ski edge. Here's one of the tongue where the ski stock went into the mouth, of the lip, and someone skied over his ears, Van Gogh injury. Someone skied over his scrotum, came together well. Someone skied across his arms, crucifixion injury, across the scalp. We also looked at deaths from skiing. Overall, we reported 29 cases over a 32-year period, and we subdivided them in the following categories. 8 were from injury, 15 from heart attack, 6 from hypothermia. The overall incidence of death was about 1 per million skier days. It was pretty low. most of these half were related to the heart. These figures compare most favoured with other sports, including tennis. It's a rare event. Here's a broken neck, C2 cross-country skier. He fell. Resuscitation on the slopes for heart attacks is pretty difficult, actually. And Australians don't really understand cold. They often turn up in shorts and thongs. So hypothermia can occur in relatively temperate climates. We reviewed our experiences. 20 cases occurred in 10 men. Rectal temperatures range less than 35 degrees Celsius. One patient presented with gastrointestinal hemorrhage, others with confusion. Some of them were drinking alcohol. They were recovered from snow, changed to warm clothing, and their body temperature allowed to return spontaneously, although in some cases we used inhalation or rewarming. There were no deaths and no sequelae, so we just advise skiers to wear proper clothing. In snow melts quickly, exposing dangerous terrain. This can cause a lot of injuries, such as fracture of the rib, pneumothorax. Near fatalities, near use of alcohol, drugs, inexperience. Australians think they can do all sports, including skiing, without any instruction. So your 17-year-old never skied before, drunk, smoked joints, no lessons, steep slope, fractured a skull, and he had residual hemiplegia. 33-year-old doctor, cross-country skiing alone, facial injuries. If he hadn't been picked up by some ski rescue team that just happened to be in the area, he would have died. However, there's much more likely to get serious car accidents, to die from car accidents in and around the slopes on the slippery surfaces. We also looked at children's injuries. Although Australian children were found to be possibly less prone to injury than were adults, so they had a low injury rate, they were slightly more serious, particularly fractures of the tibia. So we treated everybody who came through the door, including a kookaburra fractured femur, applied a paddle pop, and they're very happy. There will be a new wave of snowboarding. These injuries have been documented. In terms of medical problems, we've looked at those as well. Things such as bad facial burn, not having proper eye protection, all sorts of medical problems. Hope you found this interesting. Good luck on the ski slopes. Please follow some of the measures I've outlined.